I'm Dr. David Lickstein. I'm a board-certified plastic surgeon in Palm Beach Gardens, Florida. I was born in New York City and raised in North Miami Beach, Florida. I went up to college in Boston at Tufts University, and as you'll see, I really enjoyed living in Boston. I went to the Midwest for medical school, Northwestern University. Got to experience even colder weather than Boston. Got great training and education there. I then did a general surgery residency at Tufts back in Boston. Did my plastic surgery training in Albany, New York, and then finally a year of microsurgery at Massachusetts General Hospital, where I really had an opportunity to learn from some of the best people in the world. I had mentors along the way, including one that I met at a young age in Miami when I was 13 years old, who really tracked my progress and provided advice for more than 30 years. For me, I was interested in microsurgery and did a project for the Dade County Science Fair when I was in junior high school. And I knew from that moment that was something I was interested in. I remember vividly at Northwestern Medical School the day a plastic surgeon came in to speak and talked about all the amazing things he did, and I knew that was it. It was just the amount of creativity that was involved in solving problems, and that there wasn't one solution. You had to have amazing surgical skill, but you also had to kind of think problems through, figure out which of the best solutions would be of different choices, and I knew that was something that I would never get bored with. I've been in practice for more than 15 years in the area and have a lot of experience. The procedures that they tend to do a lot of are facial procedures, facelifts. We have a population in this area that is of the age where they consider that. And then a lot of breast surgery and body surgery, a lot of mommy makeovers. Women want to undo the damage and transform themselves after they've had children. We also see a lot of patients that need revision breast surgery who've not only had surgery before, but either want to be smaller, bigger, and improve the results that may have changed with their bodies over time. It's important to go to someone who has a lot of experience with that, whether it's on the reconstructive or aesthetic side, to be able to give you the right option. I think that there's a couple of things that will always stand out in my mind. Back in my microsurgery fellowship, I remember reattaching the hand of a girl in high school shop class that had come off and knowing how life-changing that was, as well as the thumb of an older gentleman who had hit it in a saw by accident, and just seeing his face the next day when he could see it and know that his life was going to be okay. In practice, we get these moments all the time because we have people come in, and even with cosmetic concerns, who are really unhappy and not feeling good about themselves, and then in a couple of hours you're able to fix it and see the look on their face and the impact that you have that's going to be ongoing for years and how much better they feel about themselves.